I was sitting in a forum yesterday. I was asked, what's your one priority? And I said, I get asked that question. I produce a report. We have 8 domains of recommendations. And then I get asked, what's your one priority? And I say, one thing, read my report. Well, if I was less glib, I'd say one thing, put equity of health and well-being at the heart of all policy. Because I was asked to talk twice today, and I can't bear to say the same thing twice in one day, even if it's a different audience, I'm going to talk about, it was up there for a moment. So I thought this morning I would talk about children and young people, and this afternoon I'd talk about housing. But I will give some context both times. So if there's anybody in the morning and the afternoon, I'm going to do a little exam and ask you which slides did I show twice, and you'll see if you were concentrating. On the weekend, in a storm-lashed Cardiff, I was chairing a Canada-UK colloquium on health inequalities. In fact, it was called Fairer Society, Healthier Lives. The title of my 2010 review was Fair Society, Healthy Lives. And the organizers, they gave it the title, I didn't. Fairer Society, Healthier Lives. In a way, we've got more to do. They asked me to chair this. And what is very clear, that no matter how focused people are on public health, the default position is to talk about healthcare. Healthcare. And I keep forgetting to remind people that I'm not talking just about healthcare. The new government in Westminster is thinking about improving health, and they're putting their focus on healthcare. And in a way, I understand that. And this is not what I came to talk to you about today, but it was on my mind all weekend. People like me think we know the causes of health in the population. What people vote for is shorter waiting times for granny to get her hip done. And I understand that. And that's democracy working well. Quite apart from democracy not working well, when 49.9% of the population vote for a convicted rapist and criminal and fraudster to be their president, that's democracy not working well. But when democracy is working well, people vote to have shorter waiting times. And I really get it. And I believe in democracy. I don't believe that you should give, I've been asked by a parliamentary committee, what would you do if you were a dictator for a day or chancellor or whatever? And my response is, I would mess it up. That's what I'd do. I'd mess it up because the process is important. It's not, don't give the levers of power to one person. They'll mess it up. That's the way it works. We've got to be engaged in this. So I'm troubled by how we get proper participatory democracy. That I'd like people to think, yes, the waiting time for granny's hip to be replaced is important. But so is the proportion of children age 5 with a good level of development being ready for school. We want to vote for that as well as waiting times in the NHS. When at this forum in Stockholm yesterday, when I was asked the question about one thing, and I said, look, I've been an advocate for the importance of children, and that's what I'm going to talk about today, children and young people. But I don't think we should throw older people on the scrap heap. I have a vested interest in, I did comment that I was a bit put off by how many people offered to help me with my bag. I thought, I must look worse than I feel. I can't tell you, I have this mixed feeling when young women get up to give me their seat on the underground train in London. Well, I usually say yes, because I think it's a nice gesture and I should accept. But I think, God, I really must look the worse for wear. I thought I was doing okay, but there we are. So that's all by saying that the opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. Yes, of course, we need a proper functioning healthcare system. But my concern is with the conditions that make people sick. And that led to our Marmot principles. Initially, in my 2010 review, Fair Society, Healthy Lives, we had 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, work and employment. Number 4, what an idea. People shouldn't need to go to a food bank to feed their children. They should be able to pay the rent. They shouldn't need to wear 2 overcoats indoors to stay warm. They should have enough money. Number 5, healthy and sustainable places to live and work, including housing. And I'll talk about housing this afternoon. We've done a few reports now. We've done, I think, 3 reports on cold homes. And we're going to publish a report this month, the plan is, of what house builders could do. What a thought. Maybe not just make a profit, maybe realize that what they do in their day job is important for health and well-being. Number 6, taking a social determinants approach to prevention. In the light of COVID, we added number 7, tackle racism, discrimination and their outcomes. And at the request of the Greater London Authority, in October, we published Structural Racism, Ethnicity and Health. It was for London, but I'd like to think it has broader implications way beyond London. And number 8 should have been there all along. Pursue environmental sustainability and health equity together. The current context. Life expectancy in England had been increasing about 1 year every 4 years. I've started this in 1999. I could go back to 1919, and life expectancy was increasing about 1 year every 4 years. 2010, something changed. And I maintain the fiction that I am not party political. I just argue from the evidence. If it happens to appear to be saying something negative about a ruling party, well, that's the evidence speaking. So in 2010, the rate of improvement in life expectancy slowed dramatically. And then the first 3 years of the pandemic, life expectancy fell. So we had a 14-year period where life expectancy did not improve. 14 years. I don't know of another period in peacetime where life expectancy did not improve for 14 years in the United Kingdom. Something went terribly wrong. And what happened in the UK was more marked than it happened in all other rich countries except the United States. And when I had a little moan about the functioning of democracy, in the US, they didn't once talk about the fact that the population was unhealthy. They kept saying, you know, we're the best country on the planet. Well, you are, except for crime, firearm deaths, life expectancy. inequalities. Yeah, but apart from those things, it's the best country on the planet. And that, of course, was not part of the conversation. Wow. Well, it should be here. And if we look at what happened to inequalities, life expectancy follows a social gradient, classify people by where they live, classify where they live by level of deprivation, and it's a gradient. For simplicity, I've got the least deprived and the most deprived deciles. By region, if you look at the top, the least, what did I do?
You haven't done.
Reminder, lunch breakout.
I know.
Thank you. If you look at the top, the least deprived, the regional differences are quite small. If you're rich, it doesn't much matter where you live. If you're poor, the regional differences are much bigger. And life expectancy was rising in London and going down for virtually every region outside London. So this is where we were pre-pandemic. Life expectancy had more or less stopped improving. Regional and social inequalities were getting bigger. And life expectancy for the poorest people was going down. I do wonder when the right-wing press, about 3 minutes after the election, started saying it's time to get rid of the new government. Hang on a minute. We had 14 years. I said, I'm not party political. We had 14 years where things were going very badly. It doesn't turn around in 5 minutes. It takes a while. But that's the problem we had pre-pandemic. And then the pandemic made everything worse. How did this come about? Well, the government that was elected in 2010 had one priority: austerity, roll back the state. And they did it. In 2009-10, public sector expenditure was 42% of GDP. That went down year on year. By 2019, that 42% had become 35%, 7% of GDP. Do you know what that means? At today's prices, GDP is about 2.8 trillion pounds. 7% of 2.8 trillion, come on, Alice, 180 billion. Go on, tell me it's 185. 180 billion pounds a year. 180 billion pounds a year taken out of public sector expenditure. Now you could say, well, hang on a minute, if 42% GDP, taxation was only 34%, you can't keep that going. Well, you could for a bit because the interest rates were zero. But we were told it was a moral necessity, we were living beyond our means, and an economic imperative. And then come the pandemic. And the Chancellor, here's a trick question. Who was the Chancellor at the beginning of the pandemic? It's hard, I know, because between 2016 and 2023, we had 7 Chancellors in 7 years. I said I'm not party political, but that's utter chaos. How on earth can you govern a country when you have 7 ministers of finance in 7 years, 7 secretaries of state, including one twice? You probably, oh, am I here again? Then he's out. You're going to fix things when you're there for about 6 months. 10 ministers of housing. Well, okay, Rishi Sunak was the Chancellor, and he was one of 5 prime ministers we had between 2016 and 2023. I was talking to somebody said I was in Stockholm yesterday, and he said, you know, we always looked at Britain in global circles of global health as the island of stability and common sense. And the DFID, the Department for International Development, was an important player in global health. And then chaos in Britain, Brexit and the resulting chaos. Anyway, the Chancellor said, whatever it takes, and started spending. And I thought, hang on a minute, faced with an economic crisis related to the pandemic, the Chancellor said, whatever it takes. Faced with a global financial crisis, the Chancellor said, we've got to cut spending. Hang on, what happened to the economic imperative and the moral necessity? Oh, you mean this was a political choice? It wasn't an imperative, a necessity. You mean we suffered because of a political choice? We did something this year that I'd wanted to do for a long time. Instead of people like me saying, you know, how poor the health is of the poorest people, let's focus on the health of the rich. I don't mean water skiing accidents while on holiday in Bermuda, but the least deprived tells us what's possible. Let's make the assumption that if we could get better social conditions, the low mortality of the least deprived is what's possible. So the higher mortality of everybody with a level of deprivation greater than the least deprived, that's excess mortality. And you can see the gradient. The greater the deprivation, the greater the number of excess deaths. It builds up. It builds up. And so we calculated over the period from 2009 to 2020, based on area deprivation deciles, there would have been 1 million excess deaths linked to deprivation. 1 million. Now, there was a social gradient pre-2010, but it got steeper. And we calculated that of that 1 million, 148,000 were because of the steeper social gradient, arguably linked to austerity. So as a first pass, I would say austerity killed 148,000 people. So when you hear politicians boasting, well, we got it all right, George Osborne is still boasting about how well he did as Chancellor. Arguably, you killed 148,000 people with your policies. I'm not party political. I'm just interested in the health of the public. The slope index of inequality is measuring inequality within regions. 2010-12, 2017-19, you're relatively well off in this part of the world, particularly in the Northwest and the Northeast. The inequalities within regions got bigger. And let me show you what I said a few moments ago in a bit more detail. This is the social gradient in life expectancy in London and the Northeast. I said that if you're rich, it doesn't much matter where you live. For the least deprived, life expectancy in London and the Northeast is rather similar. And then, the greater the deprivation, the greater the disadvantage of living in the Northeast. The social gradient is steeper in the Northeast than in London. The consequences for your health of a given level of deprivation, because this is a national index of multiple deprivation, the consequences for your health of a given level of deprivation are bigger in the Northeast than they are in London. Now let's look at time. The dotted line is London 2010-12, and the solid line 6 years later. And you can see across the gradient, life expectancy improved in London. In the Northeast, it went down in the poorest 10%. It failed to increase in the next and the next and the next and the next. In the bottom 60%, there was no improvement in life expectancy in the Northeast. And then it improved a bit. So you can see this picture of stalling life expectancy improvement, increased inequality, and health getting worse in the poorer areas. And that's a real challenge, because whether we're talking about Taunton or we're talking about Sunderland, Newcastle, Manchester, Liverpool, I don't know people growing up in Liverpool, I've not come across them, they may exist, who think, I must go to London or Hamburg or Frankfurt or somewhere in order to have a flourishing life. They say, I'm proud to be from Liverpool. I'm proud to be a Geordie, or I want to live here, but I want to have the possibility. We don't want people to say, well, people like us don't go to university, don't get to know doctors come from people like us, or teachers. So the challenge is, how do you make the possibility for people to have flourishing lives when the consequence for people's health of deprivation varies around the country? I've come to the southwest. And if we look at life expectancy, it varies quite a bit within the southwest region. Female, male, Dorset, Bath and northeast Somerset. If we get a moment, I'll come back to Bath and northeast Somerset. Why haven't I got... Well, anyway, there you are. There's the variation within the southwest. In our 2010 review, we coined the phrase proportionate universalism. I said I was in Wales over the weekend. Mark Drakeford, First Minister, former First Minister, now Finance Minister in the Welsh Government, he said they call it progressive universalism. Okay, well, I called it proportionate. If I'd known, I might have called it progressive universalism. But we called it proportionate universalism. What we were trying to do was combine two ideas. Typical Nordic idea of you have universalist social policies. I said at this forum yesterday that I was sharing a platform with somebody from the World Food Programme, and he was delighted when I made the case for universal free school meals, not means tested. Oh, wonderful, I'll send you material, he said, I'll send you stuff. The classic Anglo-Saxon approach is you have means-tested benefits. You don't have free school meals for everybody. You means test. If you're poor, you get a free school meal. We were trying to combine these two ideas, and we said proportionate universalism. You could call it levelling up. Less deprivation, greater affluence, better health. If you focus only on the worst off, you would, I hope, improve their health. But what about the people who are above the threshold of intervention? They've got worse health than those above them. But if you're only targeting the worst off, you miss them. So we said universalist programs with effort proportionate to need. What did we get post-2010? We plotted life expectancy for every local authority in England in 2010-12, and then looked at the change in government funding per head over the next 10 years. And what you see is the shorter the life expectancy, the steeper the subsequent reduction in government spending. What was that about? The kindest explanation I can give for this is absent-mindedness. That's the kindest explanation. They didn't know what they were doing. But that looks pretty systematic. That doesn't look like absent-mindedness. In what moral universe could that be the right thing to do? The sicker the community, the more money you take away. I had coffee with Ian Diamond, the national statistician, and I showed him this graph. He looked deeply pained. He said, it may be closer to your first explanation than you think, absent-mindedness, that, well, we give more money to those poor areas, so if we want to cut, we'll just take money away from poor areas. It's, of course, been speculated that people in the poor areas don't vote for them, so they don't lose any votes. I couldn't possibly comment, not being party political. Whatever the explanation, this is ghastly, is beyond ghastly. And when people tell me, oh, we need nice stories, we don't, data analysis is all very well, but we need nice stories. Okay, here's a nice story. This is deeply immoral. The poorer the community, the worse the health, the more money we'll take away. And I know that because I've looked at the data. So, looking at children, obesity prevalence in year 6 by deprivation, steep social gradient. Interestingly, if I took that title off and called it COVID mortality, what the pandemic did was it revealed the underlying inequalities in society and amplified them. Caries, same gradient in 5-year-old children. Now, I don't think that caries are caused by a coronavirus. I don't think childhood obesity is caused by coronavirus. And they have identical gradients, inequalities. Now, we think that caries, of course, is diet related, so to that extent, it may have some overlap with childhood obesity. If we look at child poverty rates, where child poverty is measured, these are UNICEF figures, child poverty is measured as a relative at less than 60% median income. Here's child poverty in Colombia, US, Italy, UK. It doesn't have to be that way, you know. There's Denmark, Norway, Ireland, Germany. It doesn't have to be that way. And if we look at change in child poverty, 60% median income, the UK had the fastest increase in child poverty of 38 countries. The previous government would say, when it was put to them, that under their watch, and I would say as a result of their policies, child poverty was going up. They'd say, oh, no, we've taken hundreds of thousands of children out of absolute poverty. I don't want to spoil your Tuesday morning by telling you how they measure absolute poverty. But the way they do is they take relative poverty, 60% median income, in 2010 and uprate it for inflation. And I've been trying to figure out what that means. And I can't construct an English prose sentence to say why that's a meaningful figure. And as I said, it doesn't have to be that way. Here's the UK, Australia, and Belgium, trends in child poverty. And I'm particularly concerned about intergenerational equity, because if you're going to be concerned about children, we shouldn't just be concerned with cross-sectional inequity, the difference between the northeast, northwest, London, the southwest, within the south, etc. What about the next generation? The Gallup organization conducts a poll in different countries, and they ask people, do you think children today will have a better, a worse off, or roughly the same life to you? In the UK, fewer than 1/3 of people, 31%, think their children will have a better life than them. I'm a baby boomer. If you'd asked my parents, will your children have a better life than you, they would have said yes. And they were right. We had a national health service, education, things got better. We had indoor bathrooms, things got better. Now, and they were right, now they may well be right in saying only 1/3 think their children will have a better life than them. It's interesting that in poorer countries, they still think their children will have a better life. Things will get better. The US, well, we've already said the US, the population don't know what the hell they're doing. They've elected Donald Trump, so who knows? And in the US, they won't. What the data show is for the population born in the 1940s, when they became adults, 80% had higher income than their parents. For the population born in the 1980s, when they became adults, it was 50-50. Only half had higher income than their parents, half had lower income. So they're not getting better. And again, was that discussed in the presidential election? Isn't that what it's the land of opportunity? Make America great again? One way of measuring social mobility is the way I've just been discussing. Look at income of adult children compared with their parents. In general, rich parents have rich children, poor parents have poor children, middle-income parents have middle-income children. At the current rate of social mobility, how many generations would it take for somebody born at the 10th centile of income to get to the median, to 50%? In Denmark, it would take 2 generations. In Finland, Norway, Sweden, it would take 3 generations. In the UK and the US, it would take 5 generations. In Brazil, 9. I was asked to give a talk at WHO Euro office, and the letter of invitation said, we've got a meeting of all our member states about well-being economy. We'd like you to give an inspirational address on the second day from 9:05 to 9:10. I thought it was a typographical error. No, they said from 9:05 to an inspirational address. How many slides can I show? So I didn't show this slide, but I talked about it. And I said, where would you like to be as a country, so the 53 member states? Denmark or Brazil? because I can tell you we're galloping towards Brazil. Why? What causes these differences? The magnitude of income inequality. The bigger the income inequality, the less the social mobility. The greater the distance between the rungs of the ladder, the more difficult it is to get from one rung to the next. And the second is investment in early childhood. Again, if you look at UNICEF figures, the last figures I saw from a few years ago, the average spend of OECD countries on children aged 0 to 5 was $6,000 per child per year. In Norway, they spend $12,000, Sweden $11,000, France $9,000. The average is $6,000. We spend $4,000. The United States spends $3,000. And we have low rates of social mobility. We don't invest in our children. If we look at histories of poverty and child well-being at 14, so no poverty, one-off, intermittent poverty, persistent poverty, again from UNICEF. Low word recognition at age 14, in other words, poor vocabulary skills, poor or fair health, emotional and behavioral difficulties, so the more frequent the experience of poverty, the more likely they were to have emotional and behavioral difficulties, poor health, depression, and low subjective well-being. I'd heard government ministers boasting that we were doing better on PISA than the OECD average. PISA is not a leaning tower. Well, it is a leaning tower, but it's the Program of International Student Assessment, which looks at standard measures of reading, maths, and science in 15-year-olds. So yeah, we are doing better than the OECD average, but PISA scores are declining. I wouldn't boast too hard about, well, yeah, it's getting worse everywhere, but not quite as bad here as. Now, the average includes OECD, Colombia, and Mexico, and Turkey, and countries that we might expect to do better at education than, because they have much bigger inequalities than we do. Wales, just come from Wales. Wales is doing worse than the other regions, the other countries of the United Kingdom. You'll remember that my second recommendation was education and lifelong learning. This is the real terms change in per pupil funding by level of deprivation. 2015-16, 2016-17, we stopped spending on education. In my 2020 report, we said that the spend per pupil had gone down by 8%. I remember saying, not that anybody was listening, when Liz Truss was campaigning, do you remember her? When Liz Truss was campaigning for the leadership of the Conservative Party, she said, we've got to cut taxes. And I said, why? Do you want to reduce the spend on education by more than 8%? Is that what you want to do? Why do you want to cut taxes? I was on a radio program with Ian Duncan Smith, and I've forgotten what the topic was, because he said 7 times in his 90 seconds that we've got to cut taxes. Why do we have to cut taxes? Do you even know what the tax level is? It's just gone up a bit. The tax level in the UK was 34% of GDP. In the EU 14, it was 40%. In Finland, it's 50%. France, 49%. We're a low-tax country. Why do you want to cut taxes? You want the country to be even worse? You want more school buildings to fall down? You want to leave the Grenfells unhealed? You want to cut education even further and to cut it more in deprived areas? What are you trying to do? Increase inequalities? Is that the mission and the purpose of the public sector? And if all that wasn't bad enough, children from low-income households are more likely to live in areas of high pollution, PM 2.5 levels, percent of children living in poverty. And in general, there's a relationship. Greater poverty, higher PM 2.5. And then the cost of living crisis. After housing costs, the percent of children living in poverty went up over that decade. By the end of the decade, it was around 32%. It went down marginally during the pandemic because the Chancellor said whatever it takes. And then one day, do you remember that he increased universal credit by £20 a week, £1,000 a year, right? Very welcome. And then one day, he took it away, consigning 200,000 children into poverty that weren't there the day before. And I wondered, what did he say to himself when he went to bed that night? Look how powerful I am. I just made another 200,000 children poor in one fell swoop. And I wrote an op-ed for The Guardian at the time, well read, The Guardian, by all conservative voters. And I wrote an op-ed and I pointed out, Danny Kahneman won the Nobel Prize for economics, and Tversky and Kahneman said the decrement in well-being from taking something away is twice as big as the improvement from giving something. So if you, low-income household, £20 a week, save for a few weeks so I can buy my child a new pair of trainers. My daughter can have a football strip. The daughters have football strips. I can buy my child a football strip. You save a bit. Take £20 a week away, that's horrendous. You can learn to cope with an extra £20. You can sort of figure out how to do one or two things. When my kids were young, and I'm sure the prices have gone up, and I'd take them to the local authority's swimming pool, and you think, I could afford it, but I thought, how could anybody who wasn't on an above median salary afford to take their kids to the local authority's swimming baths? Well, if you got an extra £20 a week, you could go and buy crisps as well. Take it away, and you can't pay the rent. So when the government people were saying we've taken hundreds of thousands of children out of absolute poverty, well, I said this to a government person, look at what Joseph Rowntree did, destitution. Destitution they defined as doing without two or more of six basics: housing, heat, light, food, clothing, and toiletries. That's real luxury, isn't it? Real privilege, having heat and light and food and toiletry and clothing. And 1 million children are living in a state of destitution, 2022, which is a 2.5-fold increase in 5 years. And I said to this Conservative policy person, before you boasted about taking hundreds of thousands of children out of absolute poverty, I think he was a local MP, the egregious, I won't mention his name, wasn't he an MP for Somerset, even a minister? Sorry, North Somerset, okay. Well, I heard he boasted in the House of Commons, we've taken, our government took 100,000, I can't get his appalling voice, but hundreds of thousands of children. The fact is, this is appalling. Children being admitted to hospital with scurvy and rickets, Victorian diseases, 3 million parcels from food banks last year. And JRF and the Trussell Trust calculated the cost of what they called essentials. And this is what universal credit gives. And this is the cost of essentials for a single person and for a couple. If you're on universal credit, we give you about 70% of what you need to meet the essentials. We guarantee you'll get sick. We guarantee you'll get sick because we don't give you enough to live on. A separate issue. Unemployment levels, if you're unemployed in Denmark, you get about 90% of your previous salary. If you're unemployed in the UK, you get 14% of the median income. We're very generous. We say if you're unemployed, again, we guarantee you'll get sick. And if you're in work, it's not so good either. Here's the Southwest after housing costs. If you look at the Southwest, for families in poverty, 70% are in households where at least one adult is working. So work, which should be the way out of poverty, is not. Wow, that's all pretty awful. The second most common question I get asked is, why aren't you depressed? Why aren't I depressed? We've got more than 40 Marmot places. We've just kicked off a 2-year programme of work in Scotland. 12 months ago, Public Health Scotland had its first in-person meeting after the pandemic. I gave a lecture, and the chief executive of the Scottish government mused publicly, maybe Scotland should become a Marmot country. Public Health Scotland has commissioned us to do 2 years of work, a national strategy for Scotland, and to work with 3 places. I need an interpreter when the chap from North Ayrshire and South Lanarkshire challenged my geography. Do you know where North Ayrshire and South Lanarkshire are? They're near Glasgow. Aberdeen, I knew about. I've been to Aberdeen. So we've got 3 places. We kicked off a few weeks ago in Oxfordshire. You've heard of them. They've got an important university. So they're very different. We can't pretend that South Lanarkshire and Oxfordshire are the same. And I asked the people in Oxfordshire, how does the university feel about these interlopers from UCL? And my guess was, particularly in the medical part, everything, I was on a review panel for their medical school some years ago, everything was the molecular biology of X. The endocrinologists were doing molecular biology. The neuroscientists, the public health people, molecular biology. Everything was molecular biology. So I didn't think they'd really mind. And in fact, when we had the launch of our work in Oxfordshire, and it was terrific, we had the head of public engagement for the university said, no, we're very pleased. We're very pleased. He didn't say it lets us off the hook. He didn't say that. But no, we're very pleased. We'd be very happy. And he said to me, the Vice Chancellor would really like to engage with what you're doing. So they recognize a great university justly deserved global reputation for excellence, but they recognize that perhaps they should have some responsibility for their local area, which is great. So Coventry was the first Marmot city. Cheshire and Merseyside. Liverpool says they're going to be a Marmot city in 2025. Sorry, there's Cheshire and Merseyside. Then Greater Manchester, Lancashire and Cumbria, Luton. And I mentioned I was in Cardiff over the weekend. We had this Canada-UK colloquium, and I didn't organize it, but we spent Friday in Torfen. Why are we going to Torfen? Whose idea was that? Torfen is one of the 5 local authorities in Gwent. We went to Torfen, a Marmot town. And these high-level Canadians particularly were entranced. You know, they're used to thinking about national governments, provincial governments. And here were these committed people in Torfen saying the director of adult social care, how they work with the local pop. And then these teenagers, these gorgeous kids, age 14, 15. Torfen is a World Heritage Site, which is kind of almost a sick joke because it's post-industrial, the coal mines have closed. And we're in Bevan territory. Nye Bevan was born near there. But it's post-industrial. And these gorgeous kids took us on a walking tour around the town. And, this was the co-op and that was the chapel. And this is where the workers, the adult education and so on. So it was terrific. And it wasn't just a reality testing for these senior policy people, but it was inspiring for them to see local committed people really trying to make a difference, despite all the problems swirling about. So within places, we have local government, healthcare. I do think about healthcare, but I just don't want to think only about healthcare. The voluntary and community sector, public services, business. It would be quite nice to have the national government and national institutions come in behind us. I said that Liverpool plans to be a Marmot city in 2025. Coventry, job shop. Luton, the 2040 vision aligned with Marmot principles. And I don't want to dwell on this, but Cheshire and Merseyside. So the ICB and the Health and Care Partnership engaged with us. The recommendations that came out of Cheshire and Merseyside's Altogether Fairer Partnership, that's our report, in effect gave us our action plan for the next 5 to 10 years. Being a Marmot place brings stakeholders together in Luton, making Manchester fairer, which began out of the Greater Manchester Marmot Review. I'd finish with this. It is possible to be in a state of despair. You don't have to look at Syria, Gaza, Iran, the United States, Turkey, Hungary, France, chaos. It's possible to be in a state of despair. I'm not. And I've been reading about hope. Václav Havel, the Czech dissident, playwright, I think he was in prison when he wrote this. He became the first president of post-communist Czechoslovakia. And he said, hope is not prognostication. It's an orientation of the spirit. An ability to work for something because it's good, not just because it stands a chance to succeed. Rowan Williams, the former Archbishop of Canterbury, came to our meeting in Cardiff on Sunday. And I said this to him. He was terrific, as you can imagine. There's something about him. You don't have to be part of that religion, and I'm not. But there's something about him. When he talks, you can't help but listen to his every word. It's humanity, authority, I don't quite know what it is, but it's really special. And then I quoted this, and he gave that benign smile, and he was pleased. Yeah, we need to be hopeful. And the HDRC needs, I would say, needs to think of what it's about as providing the evidence of what can work to improve conditions when all about may be very difficult. But if they can act in Torfen, post-industrial, post-mining Torfen, if Václav Havel can write this from prison, we can be hopeful about what we can do. Thank you.
Thank you so much. Amazing as ever, Michael. I wanted to ask about the graph that you showed where it was the amount of cuts in government fund was proportional to life expectancy. That seems to me very similar to the inverse care law of Julian Taylor Hart in the 1970s, early 1970s. So it seems that we know about this. We've known about it for decades. This issue of the care being where the need is not, and so forth. But nothing seems to be changing, and it's very frustrating to see that time and time again.
Well, a couple of comments. The first is that if you look at healthcare spend, it doesn't fit with Julian Tudor Hart's inverse care law. The more deprived the area, the greater the healthcare spend in Britain. Now, that's because there's more illness, but it doesn't look like the spend is inversely proportionate to need. It looks like it's proportionate to need. So in that sense, we've gone beyond what Tudor Hart wrote about in 1971. It really doesn't look like that. Secondly, I produced a report at the end of the New Labour period. I was chairing a committee on health inequalities under New Labour. And what we said was, you haven't narrowed the gap, which is partly why they commissioned me to do the Marmot review. But at least life expectancy for the poorest people improved, which is one measure of success. You want the poorest people to get better. You'd also like to narrow the gap, not by richer people getting sicker, I hasten to add. I've had people say, Michael Marmot would like rich people to get sick in order to... No, I wouldn't. I don't want anybody to get sick. I'd like improvement to be more rapid for people lower down, which is why our logo, it's embedded in our logo, is that idea of more rapid improvement. But I said that the gap hadn't narrowed. A few years later, colleagues from Liverpool published looking at life expectancy in the most deprived 20% of local areas versus the rest. And about 5 years after New Labour came into power, so about 2002, that gap between the poorest 20% and the rest narrowed. And it remained narrowed till about 2012. Then it widened again. So I don't think it's a fair summary to say, for both reasons, well, we've known about this forever and nothing changes. It does change. It changed for the better with healthcare spending in terms of equity, not in terms of overall spending. And it changed for the better and then for the worse. It didn't stay the same. It changed for the better under Labour and then for the worse under the Conservative governments. So it can change.
Can I just ask a follow-on question then? So if we know that, and there's really good evidence for it, then why do you feel that we're not very good at getting this narrative out there? Or
well, I had coffee with a former minister in the Conservative government, and he said to me, this was last year, he said, the current government doesn't like you. I said, well, I kind of knew that, but to hear it put quite so boldly by an insider, so they didn't want to know. I'll tell you a story. I was this was about 3 years ago. Well, you'll figure out which year it was when I tell you the story. I was at a summer party, and I don't move in highfalutin circles. Somebody I'd played tennis with, who turned out is in the House of Lords. But anyway, I was at this summer party, and somebody said to me, how do you get on with Sajid Javid, who was then the Health Secretary? And I said, I've never met him. And the person who asked the question said, what? You're the country's leading expert on health inequalities, and you've never met the Health Secretary? I said, nope. And somebody else asked it as well. Nope. That was a Sunday lunchtime. On Monday, I get an email from Sajid Javid's office. And I thought, who did I talk to yesterday? Who did I talk to? So that was Monday. Tuesday, so they said, could you come and see him on Thursday? I said, yep, sure. On Tuesday, he resigned. Now, the people think he resigned because he was trying to get rid of Boris Johnson as Prime Minister. I know the real reason he resigned was the word that got out that he was going to meet me. So, it's not as simple as they didn't want to know. Yeah. Even they wouldn't consciously. In fact, this same former minister, I'd met him before. When he was a minister, he invited me to come into the Department of Health to brief him on health inequalities. He really wanted to know. He was a junior health minister. And then when he left government and he was involved in the NHS, again, he invited me to come and brief him. And we did this maybe 3 times, always at his invitation. And I drew a graph for him. It's like the one that I've shown you, but not with life expectancy. It was the Chancellor's changes to the tax and benefit system and the impact on families with children by income. And over 10 years, from 2010, the effect of the Chancellor's changes to the tax and benefit system was to make people in the poorest decile 20% poorer, people in the second poorest decile 12% poorer, then 8%. And the poorer you were, the poorer you got as a result of the Chancellor's change. I drew this graph for this former minister and said, your government's policy was to make poor people poorer. And a decent person, he looked uncomfortable and said, perhaps it was not our explicit policy. What? I said to him, they're very clever people in Her Majesty's Treasury. That was Her Majesty then. Very clever people in Her Majesty. They must have known, they must have told the Chancellor that this was the effect of his policies, and he did it. So did they not care? Did they say, we just want to save money, so we'll take money away from where we're spending it? The hell with what the consequences are. So I don't think it was absent-mindedness. I think we'll cut and we don't care what the consequences were. It's a lack of care. So I don't think it's a good summary to say, well, we've known all this, it's not getting through. I think we've gone from active rejection of the evidence to what I hope is starting to be an acceptance. I mean, I met the new mayor of the North East Combined Authority. We're doing work with them. She said, my number one priority is reduction of child poverty. That's what I want to do as mayor. So, you know, I just don't agree with that simple summary. I think it's a mixed picture, and we've got people now who really want to make a difference. That's why I'm hopeful.
I think it's very interesting you talk about Torbine, because in the 1990s, I was doing my degree at Cardiff University.
Sorry?
I was doing my degree at Cardiff University in the 1990s in environmental health. And we were, as part of our degree, as the Welsh authorities devolved, we did a lot of work with Torfaen and with Rhondda Valley and Cynon Valley, because we were looking at health inequalities. And it was at that time, instead of blanket policy of funding for housing, etc., and trying to just fix problems as they came through, we were looking at a more targeted approach. So the university was approached to do a piece of work around that with Jeremy Porteous, Philip Leatherhead, Sheila McIntosh. And so we went into those valleys and we looked at a whole range of things around the housing, but also what was causing the health inequality. And I think as a result of a lot of that work, probably about 20 years working with the university and the Welsh government at the time, we're seeing a lot of what you've seen in the improvements in health inequality. I think what I learned from it, using epidemiology, etc., was instead of just a blanket approach to trying to resolve health and just waiting for the problem to come to your door, it was actually thinking, well, this is all the resources we have in Wales, let's target where the biggest inequalities are. And I think that proves hugely the improvement that we've seen. And I think the problem is in England, it's a massive area, isn't it? So money goes out to all the areas to look at those inequalities. And I think sometimes it's not targeted. And I think for a more systems thinking approach to targeting health inequality, I think we could probably get to the problem in a much better way.
Well, I've made the case that we don't simply want to target, that we want, and Mark Drakeford agrees with me, it's not just a matter of targeting. We want universalist policies with effort proportionate to need, or he would call it progressive universalism. So one of the issues, and Mark Drakeford knows this well, is that if you look at life expectancy in Wales and what happened during that miserable decade, Wales looks worse than England. And I say, you know, arguably the Welsh government has the most progressive policies of any government in Europe. Why isn't Wales doing better? Now, the first is perhaps you ought to be comparing Wales with the northeast of England or the northwest, not with England, because Wales is post-industrial, relatively poor. Secondly, the financial settlement from Westminster, even under the Barnett formula, is pretty miserly. Thirdly, and we said this in our Gwent report, we're a bit blunt, polite, but blunt. that Wales has got the Future Generations Act, which is a terrific piece of legislation. The people we talk to in Gwent say it doesn't have any impact on what we do, and no money comes with it. So it's supposed to be that but there's a Future Generations Commissioner that's supposed to look at all policies as they will impact on the health and well-being of future generations. But people in Gwent on the ground said it's not changing what they do, which is sad. So, I mean, that's a big challenge.
I think I will not take the questions from people who have another opportunity to talk to Michael. And then if there's any final questions before because I know we've overrun and some people will have meetings to go to, but any questions that are, for those that are staying for lunch, we'll talk about it. Unless Alison can one question.
I wasn't staying for lunch, and so I'm going to take a bit of privilege, but I'd like to thank you for coming. And it's so inspiring, but actually not all of our statistics in Somerset look so favourable, and actually West Somerset's got some of the worst social mobility in the country, so we remember your graphs. And what we saw in our opportunity area is the benefit of central government support and massive additional resource, and we did address that gap with gender and with deprivation. I was wondering if you could give us some hope about the new government, and if you see that they are looking at policies that will give us that injection of money, that tax bonus into the wider determinants work, because I think we've seen locally that when we had money, we did work in a particular way, it did have an impact.
Yeah, you've raised several important, crucial issues. The first one, let me illustrate what you said, to agree with what you said about pockets of deprivation. When we launched in Oxfordshire, they invited us in, and the head of the political head of Oxfordshire County Council, who was at the launch, and she said, I represent Chipping Norton, the gateway to the Cotswolds, David Cameron's constituency. She said there are pockets of deep deprivation within Chipping Norton. And in Oxfordshire, there's real rural poverty. So the gleaming spires, if young people had taken us around Oxford and shown us the spires of an 800-year-old university instead of what we saw in Torven, it would be very different. So, yeah, an area can be well off on average. Averages, forgive this indulgence. My daughter got married this summer, and my wife and I went out with my daughter and her new husband for dinner. And I said, 2 couples going out for dinner, mean length of marriage, 26 years. You can imagine what the dinner conversation would be like, children going off to university, elderly parents, and just the mean was they'd been married no years and we'd been married 53 years. And on average, it was 26. So averages can be a bit misleading. The second thing about money, the cuts to local government have been brutal. As I showed you, brutal and regressive. And yet, none of these areas, and they've been inviting us in. I mean, I started by convincing Andy Burnham in Greater Manchester to invite us in. But in the rest, they've invited us in. And none has said, look, the cuts have been so steep, there's nothing we can do. They've all said, like Kim in the mayor in North East Combined Authority. I want to reduce child poverty. That's what I want to do as mayor. So they're all saying we're going to do the best we can with the hand with which we've been dealt. And it's wonderful to see what they're doing. It would be helpful, though, to have some national support. I can't answer your question. I've shared a platform with Andrew Gwynn, who's the public health minister. He said, I'd said to him, You know, when Keir Starmer launched his health mission, I'd said this to him privately, actually on a committee. I'd said to him before the election, when Keir Starmer launched his health mission, they sent me, his office sent me the bullet points of what he was going to say in his speech. And they said, what do you think? I said, it's all right. What do you mean? Well, he's not saying anything about child poverty. He's not saying anything about housing. He's not addressing the causes of ill health in his speech. Well, whether for that reason or for some other reason, they put out an appendix to his health mission. And in the appendix, it was page 12, so you had to read. In the appendix, it said, building on the initiative of Marmot cities in Greater Manchester and Coventry, the next Labour government will make England a Marmot country. So I said this to Andrew Gwynn before the election. He said, we'll do it. After the election, I shared a panel with him, but it's been reported to me he said it more than once. We will make England a Marmot nation.
So we've got support.
So I've said to him, we'll help you if you like, but you won't do it through the NHS alone. I've said that, and I said that to West Streeting. So I can't answer your question as to what they'll do and whether they'll do it. But, for example, with this housing report that we've just done, we're saying, great, build 1.5 million new homes, but make sure they're quality and make sure you think about place. You know, the impact of where they are and the impact on communities. So, I mean, building 1.5 million new homes will be important, provided it's done with health and well-being at the heart.
Thank you so much.
Thank you. We'll wrap up there. So just give a final thank you.